I am here with a bonus episode of the Hood Talks podcast, season 5. And I'm so excited because we're trying something new. We're trying to advance a little bit, do some different things, get out here inside of the community. And I want to shout out Mid-America Transplants. We are literally on location right now, coming to you all, doing a conversation around donors and recipients. Now, y'all, this is a tough conversation. The girl was scared to do it, but I'm jumping out of my comfort zone, and I'm super excited to hold this space, to have this great conversation with 2 great guests. So excited, y'all. I think it's going to be great, but I do want to take a moment again to give a shout out to Mid-America Transplants. Their mission is we save lives through organ and tissue donations, okay? I know, y'all, don't be getting all uncomfortable. I know it is a very touchy topic, but we're going to learn a lot today, okay? But we're going to get into this conversation. I'm going to let my guests introduce themselves. I'm going to start with Tiara. Please tell the folks who you are.
Hi, my name is Tiara Johnson. I am a heart transplant recipient. I've had my new heart for about 3 years now.
3 years? That's it. What else you do? You outside. She got it real simple.
Outside of that, I am a certified community health worker. Yes. I'm a patient educator, and I'm also a life coach for individuals with chronic illness, specifically those in need of an organ. So I work with patients to kind of help them navigate the process and also help their family members and caretakers as well.
All right, girl, I'm about to say, I know that track record alone. I know. Amazing. Yes, right? Yes. Okay, Dr. Knight, you ready?
Sure. So I am Gina Knight, and I work here at Mid-America Transplant, and my role here is to work in the community and donor family services. So I help with several of our programs in terms of education and also getting out into the community to make people aware of the gift of life through donation.
Yes. I got a lot of questions for you. I do. I do want to give space to you, Tiara. I think it's important and impactful to hear people's story. Like I said, I was scared about touching this topic because I know there's a lot of, and I personally myself deal with a lot of the distrust between being a donor. But after hearing impactful stories from recipients like you, I was like, okay, I think we need to touch this in our community. So I would love to hear your experience throughout your journey of now having your heart and your new heart and how that.
You want me to start at the beginning?
Start at the beginning, yes. How did you even get to the point where you needed it?
So like any young married woman, I met my husband. We got married 6 months later, and we planned to have a child. And, throughout that process, I had a normal pregnancy up until the last week. My blood pressure just kind of skyrocketed, and they decided to induce me. And this was my second child. And so during labor and delivery, I just felt something wasn't right. Mm-hmm. It was nothing like my first labor and delivery with my oldest daughter. Nevertheless, after 18 hours, I had my daughter. She was perfectly healthy. And once I got home, I couldn't breathe. Mm. Oh, wow. I couldn't breathe. I didn't feel better laying down. I didn't feel better sitting up in the recliner. And on day 3, I told my husband, I'm going to get in the shower. Once I get out the shower, if I don't feel better, I'm going to the hospital. Right. And so as I'm in the shower, I can hear water in my lungs. Oh, wow. So I go to the hospital, and they're like, oh, this is normal postpartum, we're just going to give you some diuretics, which basically pulls the extra water that you have on your body out, and you're able to, clear up your lungs. And so I went through that process a couple of times, and that was it. Each time I'm being dismissed in the hospital.
The dismissiveness.
So I had my daughter July 31st, and symptoms started, I want to say, August 2nd. So I went back and forth to the hospital over 10 times, dismissed every time.
Wow.
And so fast forward to October, I told my husband, like, something's still not right. I don't feel well. I can't move around my house. I'm just not doing well. And so I decided to go to a different hospital.
Good for you.
Immediately, I'm diagnosed with heart failure. And not just heart failure, end-stage heart failure. This is 3 days after my birthday, my 26th birthday. Now I'm being told I'm dying. So I was immediately placed in a life vest, which is like an exterior defibrillator, which in the event that I go into cardiac arrest, this device is able to revive me. And so I kept that device from October of 2015 until June of 2016. And it was at that point, my heart wasn't getting better. My cardiologist was like, look, you might want to consider getting an internal defibrillator. And so I decided to go ahead and get the defibrillator. And we're still doing all of the work. I'm going to try to speed it up. I don't want to be too long-winded, but we decided to do all the work and go ahead and implant this defibrillator. And so a year has passed. We're thinking that my heart's going to recover, and it still hasn't. Now, when I was diagnosed, my heart function was 10%.
Wow.
It was functioning at 10% of what a normal person's heart would be. And I continued working. I would literally be in the hospital at the time. I was a leader at a nonprofit in Detroit. And my mindset was, I got to be at work. I got to be at work. I got to be at work. So I'm getting out of the hospital, go home, shower, put on some clothes, straight to work. I never stopped. And so years passed, and we're now at year 3. My heart is not getting better. Medicine's not working. And so my cardiologist is like, I can't do anything more for you. We have to refer you out to the University of Michigan, where they have like an advanced heart failure team for individuals who might need a more interventional therapy. And so I get there and I meet the cardiologist, and she was very frank with me. She said, at this point, there's nothing I can do for you. You don't qualify for a transplant. You don't qualify for an LVAD because your BMI is too high. That was the only thing that was holding me back. But it was how she said it to me.
Very dismissive.
I told my husband, I am never going back to see her again. Never. And it was like one of those moments where you need that honesty, but it wasn't delivered gently. That kind of pushed me away. And so I had some time to reflect afterwards, and I'm like, this not going back is not going to answer. That's not the answer.
Yeah.
Like, you have to fight for yourself. And so I went back to the hospital, and I started working with the nutritionist. I developed a relationship with my cardiologist, like working together. Throughout my journey, I always say, your relationship with your physicians, your specialists, whomever, it's a partnership. It's not a dictatorship. You know, it takes both of you to be involved throughout the process to get you to your goal. And so now we're still close, even though I'm not in Michigan anymore, we're still close. And I started to do the work. I'm like, okay, if the only thing that's holding me back, if I got to eat grass, I will eat grass. And I was serious. I told my husband, I'm going to do what I got to do. And so I started to lose the weight. In order to be listed for transplant, I needed to lose 100 pounds.
Okay.
Now, that's a very daunting task for anybody. But for someone in end-stage heart failure with the EF now less than 10% and trying to lose weight, I can't work out.
I was just thinking.
And so now it's time to reverse all of those things that we're taught in our culture, how we cook, how we prepare our foods, how much we eat, plate size, all of those things. And working with the nutritionist, working with my therapist, working with my cardiologist, I became empowered, and I wanted to start empowering other patients. And that's kind of carried me throughout my entire journey as something to focus on, being that person for someone like me that was sick in bed and not knowing where to go. And so fast forward to March of 2019, I was hospitalized, like an emergency situation. I get to the hospital. Now, I've lost weight for an LVAD, but the doctor that's on call says I'm not a candidate. We're not, you are actively dying. You may want to consider hospice or palliative care, but you are not a candidate. And so I left the hospital against medical advice. I left. I got in an Uber, over $100 to get home. I went home, and not even home 15 minutes, I got a call from a nurse, and she's like, I'm calling you as a mom. I'm not calling you as a medical professional. You need to go back to the hospital. You're too sick to live at home at this point. And so at that point, I'm crying. My husband's looking at me. He's crying because he doesn't know what to do. He feels helpless in the situation. And I'm telling her my frustration is because I'm in the hospital and this doctor does not care.
Yeah.
He's not listening to me. And you're in and out in 5 minutes. You're not taking on empathy to my situation.
Yeah.
Even if it's bad news, how are you delivering that news?
Yeah.
And so I cried. She sent me a lift. I got in the lift and I went back to the hospital. And I ended up with an LVAD 4 days later. When I got there, there was a new doctor on rotation. Very nice woman. She sat bedside with me, kind of educated me on what's going on with where I am health-wise. And I was on the roll. Now, once I got my LVAD, which was the HeartMate 3, life was awesome. I have a cardio MEMS. I still have it in my pulmonary artery, which kind of keeps my body from being overloaded with fluid. And then I have my LVAD. So now I have my quality of life back. I'm able to clean my house. I'm able to dress myself. I'm able to bathe myself. And I'm learning to live with this device. And so I kept my LVAD for 2.5 years. And then in April of 2021, I ended up doing like a segment for Mother's Day on the news, and I got Stephen Johnson syndrome from a medicine that they had prescribed me, thinking that I had gout, but I didn't. And that medicine caused my entire mouth to be burned out. And so in the hospital, they were kind of talking to me about like getting me listed for transplant. Like, now you're ready. Now you're ready. Unfortunately, that medication also caused my A1C to go up. So now I've lost 100 pounds. I'm doing well. Now this medication has me in a burn unit. I can be listed for transplant, but my A1C is too high. And when they called to tell me that my A1C was high, I was very upset. I just feel like it was another hurdle in my way. And so my cardiologist told me, she said, Tiara, next time we go to transplant board, we're not telling you anything because you can't be in here cussing out the people calling. I was mad. I was yelling. I wasn't cursing them out. I was mad at the situation that this medication that was given to me has now intervened on my ability to get a heart. And so she didn't tell me. She did not tell me at all. I was honored at the Heart Ball that year, and I did not know the same day I was listed for a heart. And so as I'm on stage getting awards, I am now listed for a heart. The following Monday, I'm talking to my therapist, and she's like, I'm so glad you're listed for transplant. And I'm like, no, I'm not. And she's like, I'm so sorry they didn't call you yet. No, they didn't. And so she kind of spilled the beans. And so I ended up getting listed. I was hospitalized for something unrelated to my heart, and they said, we want to list you as a status 3. Now, with this mechanical, the HeartMate 3, you're automatically listed as a status 4. You're stable. And so I had other issues, aortic valve leak, that made me need a heart faster because they wanted to do open heart surgery again. Every time you get cut, the zipper, you're creating more scar tissue. It's more risk. It's riskier. And so I was literally going in November to get this surgery. Luckily, them wanting to list me as a status 3 worked. I got discharged from the hospital on Friday, and I said, I'm going to go home and make memories with my family. I'm not going to think about getting transplanted because I was checking the UNOS website every 2 minutes. There's a way you can filter and check out how many people are waiting, and you can filter your blood type, your region, your state, like all of the specifics. And so it'll be 24 people. Then it jump up to 32. And I'm like, why is more people needing hearts? Like, it just fluctuates. And so I came home Friday evening. We went to go see a movie, Ron's Gone Wrong, Saturday morning. And once we got out the movie theater, I got a call on Saturday. And I'm looking at my phone. I'm like, they don't do follow-up calls on a Saturday. And my kids are in the back seat, like, answer the phone, Mom. My husband's went in Walgreens to get medicine for my daughter. And they called saying that they had a heart for me. Now, once I was listed, I put a call recorder on my phone. So I have my actual transplant call. And that's something that I frequently listen to when I have bad days. But it's near and dear to my heart. It was a long journey. 7.5 years. And 2.5 of those years were with my heartmate 3. But I was fortunate. I was fortunate to receive a heart in 20 days. It's not common.
20 days. Wow.
Yeah.
That is not common.
It's not common. I was B positive. That worked in my favor. For some reason, I did not have any antibodies. With every child you develop antibodies. They tested me 5 times. I had 0 antibodies. That's nothing but God. Nothing but God. And so here I am now. I've had my heart for 3 years, living and thriving. I haven't had any complications with my heart. A part of this segment I do want to include, if you are in need of an organ, doesn't necessarily have to be a heart. I accepted a high-risk organ. So my heart donor was an IV drug user. There are legal ramifications on what you are able to know about your donor, unless their family reaches out to you, vice versa. So far, I don't know any other information, but that this person was an IV drug user. And so after transplant, I went back to work in a mental health hospital in Michigan, and I worked in the substance abuse unit with those individuals that are detoxing as a way to give back to my donor. So that's my story in a nutshell. Lots of little hurdles in there that I didn't include, but
we hear a lot. I heard a lot too, and I'm coming to you because I got so many questions, but I heard a lot of the dismissiveness, the delivery, the lack of empathy, the process, the barriers, the unknown, the not taking time to educate, is what happens a lot when we talk about in the healthcare system for Black people.
Yeah.
Those are common themes. But what I also heard that I think is important that you said, fight for yourself. You said, I had to fight for myself. And I think sometimes people give up easily. And I know we shouldn't have to fight, but you have to fight for yourself. So I'm grateful that you did that, because you wouldn't be here if you didn't fight for yourself. So I take heed to that, and I wanted to just uplift that. But I think now I'm coming to you because we got to address. It's a lot of the dismissiveness and the education part, and the misinformation. There's so many things that I want to talk on. I want to start though. Let's start with the misinformation when we talk about donor and recipients. Can you tell me specifically what are some common myths?
Yeah, so one of the big myths that are out there in the community is that if you are on the list, that doctors are going to see that you're on the list, and therefore they are not going to give you the best care. They're going to rush you through because they want to get your organs, right? I mean, it's something that has just been perpetual in our conversations around organ and tissue donation. The reality is that doctors have to do everything they can to save lives. They don't even know essentially that people are on the list until folks are at end of life. And they have tried everything that they can at that point. But it's still a myth that's out there. I will say that it seems like that myth is being dispelled a bit more. But it's still out there. Another one that still is one that we have to tackle is religion. Some folks have the idea that in given religions or given sects of religion, it is not permissible to give organs and tissue, and that's not always true. Most religions, especially ones here that we honor in the U.S., are open and able people are open and able to donate if that is their wish. So yeah, that's a big one as well. We actually have someone here now that works with faith-based organizations, Dan, Dan. And that's really something big that Dan does, is he goes out and he connects with churches and people in the faith-based community to talk to them about the need to educate.
Yes.
And let people know that we need folks to sign up on the registry. So those are two of the big myths that are still out there. And I would say there's a lot of confusion too, because sometimes folks just don't talk about it.
They don't. Or when they do talk about it, it's only from the avenue of the bad, of what was heard, which is how a lot of times people get their information, right? It's through each other. It's through their community. It's through their spaces, their families, their friends. And I would agree with you. When I even told someone that I was doing this, that was the first thing that was said, was like, girl, if you get on that list, they gonna come for your organs. But I heard you say that a lot of times doctors don't even know. So if you immediately go to the hospital and you're ill, it's not like they're going into the data system and saying, oh, let's see if they're a donor.
Correct.
There is not. I also worked years in the medical field in the ED. We're not looking at that. It's nothing that's going to pop up in Epic or Cerner or whatever EMR that's going to say organ donor flashing. It's a whole process. And when that person gets to end of life, and then that's when they start reaching out, what's really important that I want to make sure that it's included. Have the conversation with your family if you have opted in to be a donor, because we see that a lot with people have checked the box, but they have not informed their family. And so now they are in this situation where they're at end of life and their family does not want to donate their organs, but they've already checked the box. And so if you do decide, make sure you're having that conversation with your family and include why. Share your why, because that might prompt them to do the same. Yeah.
I agree with you. I think because it is a hard conversation to have, it's a very tough conversation. So even if you're like, okay, I decide to do that, and if you go tell your family and they're like, why are you doing that? What's wrong with you? Like, girl, you trying to get, what is happening?
Yeah, in our community too, just even talking about death and the possibility of death. And so then we start talking about illness and things that we need to do to be healthier. All of those topics are not necessarily well discussed or received amongst all of us, right? We start to talk about some of those things when we have a crisis. But outside of a moment of crisis, we typically don't want to talk about it. It's almost like sometimes if you talk about death, people think that death is going to be around the door.
Yeah.
Like if you talk about it, it'll happen.
You're breaking it up.
Don't do it. And so even that, we have to become more free to talk about life and illness and death and what we would like in terms of our wishes. So I agree with you as well that there has to be more conversations amongst family members in terms of what we want.
Even in just crisis though. I mean, from your story, you were healthy in a sense, normal, like going through your life, not even thinking that this was something that would impact you. It wasn't even it wasn't on your radar. You never had any, I'm assuming, right? No heart issues. Any of that. And it just all of a sudden, in a sense, because of during the pregnancy, which things happen, you had to go through this now process. So sometimes we don't think about that things can happen.
And when we start talking about postpartum, right, issues with moms, particularly Black maternal health, the number one condition that is causing Black moms to die is heart conditions. And many times they have not been known or were never an issue, never elevated. It was never talked about, never came up until after that baby was born.
Yeah, so that is part of the work that I do. So it's called, I don't know if I mentioned it, it's called postpartum cardiomyopathy. It can happen, during that last trimester or up to 6 months after giving birth. And it is not in the OBGYN office. It's not on the pamphlet. It's not on the magazine. It's not on the wall. You see everything else, everything about gestational diabetes, all of the things, but you don't see anything regarding postpartum cardiomyopathy. And so that's part of why I do what I do, because we need to have the conversations, and we need for medical professionals to have that conversation.
Yes.
And make sure that they're including that in the plan of care to make sure, even if this person, like I said, I had no pre-existing conditions, but hey, these are some of the things that could happen. And here's some material and information on that, And so I think that's something that does need to be implemented within our system.
Informed care is what we call it.
Yes.
Making sure patients are educated and informed about all things that could possibly happen, or that they could possibly have to deal with. Doesn't mean it's going to happen, but it's better to be prepared than not to know and then have those sudden.
Yes. And moms want to be educated.
Yes.
We want to be educated.
In a positive way.
In a positive way, correctly. For sure.
Yes.
There's this, we all know, I should say, the idea that doctors have limited time, right, to talk to us quite often. But I always encourage moms to, this is probably part of your work as well, take a list of questions that you have so you can get down to the nitty gritty and ask the things that you need. And if you want your doctor to give you more information, ask them specifically for the types of information that work well for you. So, I've heard moms say, oh, I like reading articles. And I'm like, really? Like articles? And I'm like, yeah, I want articles. I want to get down into the nitty gritty of things. And so we have to make those requests too and require it. I love that same way in terms of what you said, Shavannah, you found another physician and you found someone who, that is an option. I think sometimes we get out of this idea that we have the options, and we have to keep searching for people who are willing to work well with us and listen and center our voices, right? So that we can decide how we want to live, as opposed to, oh, okay, you're the expert. Well, you just tell me what to do.
No, I will get a second, third, fourth, fifth, sixth opinion if I have to, because I deserve quality care. Yes. You deserve quality care. Yes. You deserve to be heard and listened to. Yes. And again, it is a partnership. It's not a dictatorship. So if you're not comfortable with something, you have every right to voice your opinion and say, I'm not comfortable with this route. Yes. What are the alternatives? So
one of the things that we try to empower people at Mid-America is to understand that yes is a strong decision, right? It gives you the power and the ability to make a decision about how you would like things to happen after your life, and your desire to actually care for and take care of additional people in the world and in our community. Because I think some people feel like, oh, well, we don't want to press it, right? We don't want to press it as an issue. It's a privilege, really, to be able to say yes, if you so desire, to help all of those additional individuals through tissue and organ donation. I think it's an incredible gift, right? One that you don't even get to see necessarily unless you believe in certain things in the afterlife. But just to think of all the folks that are then helped after you pass is pretty amazing. It's really amazing.
And just thinking too on that, talking in depth of thinking about representation, right? And I don't know, there might be science to this. I don't know. But I know, like you said, screenings, having to know who, because I'm sure there's tests and the heart has to be able to, align and things like, So if we have, just thinking, if we have more of us who are giving and have, will be able to maybe help more of us in a sense. I don't know. Help me understand that. And maybe I'm sure that's what some of the listeners will want to know too, right? Like, is that something that would be beneficial to Black people? Because I know probably in the sense though, we're all inside the organs are human organs, but is there certain things that could dictate how, if more Black folks were donors, that we can help more of us?
Well,
in a sense,
I want us to think about it from the perspective that there are more of us waiting. Right. So because there's so many more of us waiting on the list, yes, we need a larger pool.
I got you.
Right. The pool that we have is in motion, but there are more of us on the list. And yet we tend to be those who are like, I don't know about that.
until Big Mama gets sick, then everybody cares.
And everybody, yeah.
Goes back to also health equity in the sense too, though. There's more of us on the list. Can you talk to, because there's probably less of us giving, but what are the other barriers that prevent folks from getting transplants?
Yes. So, depending upon the care that you've received, and let's just go back and let's say all of this is valid. We know that historically, Black health and Black bodies have not necessarily been given the regards that we are due, right? We have a history that is very painful in terms of things like experimentation. And I mean, we can't pretend like that isn't part of, like you talk about Big Mama. Big Mama remembers some of those stories.
Yes.
And she may have even known someone, depending on her age, who will tell her that her, part of her maternal system, her organs were not necessarily given proper respect. Okay. And we're talking about here in St. Louis. So I mean, we have to
acknowledge the history and
be
the harm.
honest about that.
Yep.
Exactly. There is a history that we are also still moving through.
Yes.
And not necessarily just able to move from. So when we talk about health disparities in our community, we're talking about generational trauma. So there are these stressors that impact us down to our cells. And we also have health disparities across different areas in our community. So in some communities, you don't have the same access to the same types of doctors and specialists and programs and resources and transportation.
Yes.
I mean, we can kind of get into that whole list of, insurance. Do folks have ways to pay for those providers?
Costs,
But again, yes, and even lack of education. Because if that is not transmitted down through generations, right, then you don't even know that that's something that you should be pursuing. That maybe I'm not going to take the bus and go one side of town. I would take the bus and go to the other side of town just because I think I could possibly get better care. Yeah. So it's really about, understanding that we have this history that we are moving forward through and really needing to educate ourselves and our community so that we can have greater health outcomes, for ourselves, doing our work and also educating physicians and people in the medical field. I think part of what I heard you say too was like, we have to let them know that this is what we need. And that's real.
Yeah.
That's real.
Yeah. We definitely have to do our part when it comes to educating ourselves and knowing that you don't know if you don't know, And it just takes one person in the family to say, like, no, let me look into this.
Yeah.
And then pass that information down, light the spark, and so that we begin to transform. Because some of the things that cause recipients to get to this point is generational. Along with that trauma is how much sugar you put in them yams on Thanksgiving.
Yeah.
What you put in them greens, how we prepare our foods. And it goes back to access, in our communities, what's on every corner? Fast food, the liquor store, or church.
Yep.
Those three things. It's empowerment. It takes empowerment to get individuals to want better.
It is.
Because poverty is a cycle.
And to think that I even deserve better.
Yeah.
Sometimes it's easy to sit in, this is all I deserve and this is it. And I'ma survive. I always say a lot of the community is in a survival mode, and we've been in survival mode for so many generations. And a lot of things that have passed down has been because of survival.
And we sometimes don't even acknowledge that we need to stop. Right. I mean, how many times do you hear a Black woman, how are you doing? Oh, I'm good.
Yes.
And it's like, no, you're not.
You heard me say I was still working.
Right. Even though your heart was at 10%.
Yeah. I kept working. And then in year 3, my husband's like, no, resign. That's it. You're done. You're not going back to work. And so, especially for maternal health with moms, we always want to wear this cape. We're strong. We got this. Keep going. You got to know when to stop and listen to your body. What are you feeling? Don't just dismiss it. Oh, I'm tired. I'm tired. Keep a medical journal. a diary, even if you don't have a chronic illness. Write that stuff down. Put the date so you can refer back to it. Write the questions down that you have for your physician. Take it to the doctor with you. All of that stuff matters, especially when you get into now you're at the point where you or your loved one might need an organ. And also, if you don't feel comfortable speaking up for yourself because of the trauma, everybody's not comfortable with advocating for themselves, or they're not at the point where they can.
Yes.
Take somebody with you.
Yes, doulas.
That's able to voice your opinion at the doctor to get that concern out, to get those questions answered. That's really, really important, especially in our community.
Yes, absolutely. Doulas are very important. So I definitely suggest y'all get y'all some doulas. Community health workers. There's also patient advocates. Some hospitals have patient advocates. So find someone. Again, it goes back to what you said. If you are uncomfortable, question, ask all of the questions, but fight for yourself. Stick up for yourself. Stick up for your family members. Because sometimes, like you said, it might not be you may not be the patient, but maybe it is Big Mama, right? Or maybe it is your child or your husband, your spouse. Hearing your husband like, hey, trying to encourage you, like, no, stop. You're not gonna work no more. No, maybe you should go back. Maybe you should ask this. I think it's really important in the dynamic for Black women is having that partner who's there, who's also in the room and being educated, making sure that, the husbands, the boyfriends, the partners, you all are in the space as well with women during these times so you can be aware is important as well. I do. Go ahead.
To say something.
Go ahead.
The community is wonderful, right? If you do things in community with other people. I mean, we think about it when we go to like certain events or certain like a dance class. It's just so much more fun when you have a group of folks who are all there showing up with joy, right? And so when we think about that pertaining to our health, it's really easier and better if we think about doing it with community. So if that's going to the doctor with someone and having that support in that way, if it's weight loss, having somebody who can do it with you is a little bit easier. It can be a little bit more fun. So just really thinking about the resources that we do have in our community is really key in terms of our health.
And there's a lot of resources. I can't say that enough. It's a lot of programs. There's a lot of things that folks are doing, especially around health. So I agree with you, finding that community. And I think community is important. I just said that recently that the way we're going to get through what we're going through right now is in community. It's not being siloed or individual. It's going to have to happen within community. And we know it's sometimes not easy because you have to be vulnerable. A lot of these conversations take vulnerability to say that I'm not okay. I'm struggling, but that we know that is a hard thing for Black women because we've been the ones to kind of just hold it all together. I do want to touch on, again, a little bit more about the distrust. And specifically from organizations like Mid-America and the work that you all are trying to do, bridging that gap. How can more donor organizations strengthen trust and build lasting relationships with specifically the Black community to help bridge this gap?
Yeah. So it really is about more conversations. Like we now, between our calendar year of 2024 to 2025, we have looked to see where else can we go to just have conversations with people. Again, it's not about trying to push people in any given direction, but it's about like, if you want to, this is how this decision impacts so many other people. So we do, in fact, we try to get out to our local schools. When we have health fairs in the community with places like the Urban League, we try to partner with them. In the fall, we partnered with the First Lady's Women's Health Equity Symposium in Hazelwood, and it was just a huge audience there. And it was amazing. People just sort of gravitate to the table. And again, I think that speaks to the fact that people want education. We want to know more about it. We're not as afraid as we used to be. But we really do try to make an impact. We try to leave a larger footprint in the community in terms of touching people and giving them some education about what we do and what it looks like. And then we refer them if they have additional questions or they need some additional information. If they want presentations in their churches, in their organizations, then we can do that so that we can continue to educate folks. And inspire them, really.
Yeah. That's good to know, because I think it just goes back to, I agree with you, having the conversations, which I know sometimes it's hard, but we need to have the conversations, being aware and knowing your rights. Mm-hmm. Many people are unsure about the rights, right? Can you talk to what are some rights that donors and their families should be aware of?
Yeah, so donors, so let's say, first of all, when you go to the DMV, and now we have some opportunities even online, the question is asked.
It is.
So that's your first point of contact right there in terms of your rights. You can say yes there if you so desire. Once you have said yes, it is again important to talk to your family members, because if you are not able to advocate for yourself, or you have some specifics around what it is that you desire in terms of organ and tissue donation, it's important that your family knows, right? Mm-hmm. So that's also a right in terms of making sure your family is aware, your doctors are aware, people around you are aware of your decision. So post-donation, if we sort of go to the other end of things, we have lots of different things in place in terms of ensuring that people's privacy is protected. However, and I think you were talking about this story, I don't know if that was before the podcast started or not, because we've just been talking, right? You had mentioned sort of that connection between donor families and recipients. Mm-hmm. So that's really where my department comes in. I have an awesome department, awesome team. If we have recipients or donor families who reach out saying, you know what, I want to know more about this person who was such a part of my life, then we actually send information forward to see if we can connect those individuals. Sometimes it's not the right time for either party. And if that's the case, that is protected. Your right is protected in terms of, you know what, we're going to give you the space to grieve, to work through, to resolve, to think about. And then if you become ready and you want to meet them, we'll facilitate that for you, right? And it's really beautiful when that does happen. It's like, you know, all the tears, right? Because folks come and they see that person who carries their heart, the heart of their loved one, or the corneas of their loved one. And it really is impactful. But you have every right to make these decisions, pre-donation, post-donation, donor families, as well as, you know, recipients. And, you know, it's not something that's forced, or no one gets to make that decision for you. You know?
Yeah, it's the decision you make. And we're not forcing it. I'm not forcing it. Mm-mm. We're having the conversation because we want to educate our community and address. There is, like I said, we have to address and acknowledge that there is a disconnect in this space. Yes. But we also know that a lot of us may, you know, need the support and may need an organ at some point in time. Yes. So,
and recipients have rights as well. It may not always be that the family is not ready. Mm-hmm. The recipient might not be ready. A lot of the individuals that I work with that do get transplanted, they have guilt. The number one thing that recipients will say, someone had to die in order for me to live. And that's not true. Someone, unfortunately, was placed in a position where they're at the end of their life, and they made, or their family made, the conscious decision to donate their organs to extend the lives of others. Someone did not die for you to live. And that's very important. And so a lot of people struggle with that.
Yeah.
So it's both sides. The family might not be ready, or the recipient might not be ready. And also
survival remorse.
I am a great representation of what organ donation looks like with no complications, right? Mm-hmm. It doesn't always look that way. I have a close friend. She was actually my roommate in the hospital when they listed me as status 3. And we just became close friends. Same doctors, same surgeons, same everything. her journey looks a lot differently than mine.
Mm.
And so sometimes that is a lot to deal with. I literally had a breakdown when I came home because now I have this book with all these rules. I can't have flowers. I can't have dirt. Like, people are literally sending me flowers and we're having it. She can't have it. She can't have it. She can't have it. You can't be around it.
Wow.
You're not supposed to garden. You got a pet bird. You got a turtle. You're not supposed to have that.
Wow.
You got this long list of foods that you can't have. Depending on what medication, that list might be a little longer than somebody else. And so for the recipient, it's a lot. It's a lot. You have all these medications. You have to know what each medication does, what it's for, why you're taking it. We have to take our medicine on time every day. You're not supposed to miss a dose. You know, and so it's a lot on top of being a mom, on top of being a wife. That is a lot to carry.
It's a lot change.
And if you're not well, it's probably not best. Even if the donor family does reach out to you, you might not be in an optimal place to reach back out, because who wants to talk to their donor family and they don't have good news?
Mm.
You know, you might want to wait a while. So my hospital, I was transplanted at the University of Michigan. They have a rule. Minimum a year. They can't reach out to you. You can't reach out to them. That is the rule. And from there, even if the recipient is not in a stable place mentally,
it's not good to.
They won't allow you to. And the rules are there to safeguard both the families and the recipient. So it's a lot. It's a lot. It's a lot. You know, I try my best to stay positive, but I have bad days too. And I'm a mental health facilitator. I have bad days where I'm like, I am depressed. Leave me alone. Give me my cookies and my blanket, and I'm going to stay, you know.
I think that's human.
And it's okay. So if you are watching or listening to this and you or a loved one is in need of an organ, it's okay to not be okay.
It is okay to not be okay.
And toxic positivity is a thing.
Yeah.
Oh, just pray about it.
That is definitely.
Don't tell me to pray. I know the Lord, and I know to pray, and I know He has the last word, but that does not dismiss how I feel.
Yes.
That doesn't dismiss how I feel.
Yeah.
So sit in it. It's okay. Sometimes you got to sit in it, but eventually you got to get up.
And I love that you said, and I love that you talked about this, because I think sometimes too, people are like, oh, she got a heart. Okay, I'll get a heart and I'll be great. You know, everything will be over. But
no, no, don't think that. No,
it's a process, but it can be a big life change and an adjustment to adjust to.
And also I was never diabetic. My heart's fine, but when I woke up, I'm immediately diabetic. I now have allergies that I've never had before. I had a banana, my whole mouth and tongue swelled up. You know, so there are myths. They say, do you take on some of your donor traits? It's a whole thing. But that's a lot to work through. Yeah. You know, in itself, that's a lot to work through.
It is.
Yeah.
It's a process.
You know, we've talked a little bit about just sort of the mental health piece, and
which is probably a big piece.
Oh yeah. The reality is, you know, that we as a community, we've gotten better and more open to utilizing therapists and counselors. And you'd also mentioned other folks in the medical field and advocates, and so many people now that are in the community to support individuals at various stages in life and in health. And I think too, it's something to remember that as we go through different processes, sometimes we have to reevaluate and reassess who we are connected to in terms of those resources and in terms of those individuals. And sometimes, you know, you may have never felt like you needed a therapist before, you know, when you were in your 20s, and all of a sudden you hit 30 and you're like, well, I'm crying so much, you know, what's going on with my life? Yes. But just continuing to be open to the fact that there are other people who can support us as we're experiencing these changes. Something that you mentioned in terms of really, like, this was life altering. Right. And no one could predict that. And no one really knows your experience other than you, other than what you share. Mm-hmm. And so just reassessing to say, you know what, okay, what do I need now?
Yes.
I think is an ongoing process that I try to get Black folks to understand. As we evolve as people, sometimes the folks around us, they have to come up too. Mm-hmm. They have to evolve with us or not.
Or not.
You can stay there. I can only drop gems, and that's what I keep telling myself. Like, you can only drop the gem. It's for the individuals to do the work. Beyond that, and peer support. Yes. You said you met a friend. You created a community, a peer who is going through the situation similar, not exactly the same, but similar to you, who you can talk to. You know, y'all formed a relationship based off an experience together. I am such an advocate for peer support. Yes. I think it's valuable. Yes. Shout out to all of the other folks, but I do think peer support is just as valuable as a therapist or a counselor. Yes. And we need sometimes those folks.
I want to say have both, and I'm going to give a very specific reason why. And most transplant programs have it where it is required that you have a mental health clearance.
Which you should.
Yes, peer support is very important. You bond with someone who has a similar journey or been through that journey. But also, you want to use discernment and be careful with that as well. So throughout my journey, I joined all of these groups on Facebook, right? And when you get to the point where you are now receiving a mechanical circulatory support, which is the LVAD, which a lot of people have before they get to transplant, you will see and read some scary things.
I can only imagine.
And then people will, I don't want to transplant. I'm not doing it. I'm not doing it now. Your journey is your journey.
It's different than everyone else.
Your journey will not look identical to anyone's because it is your journey. It's your role. Your job is to get the support you need, get the education you need. And like they say, eat the meat, spit out the bones. Know when to log off and be like, okay, this is enough. This is triggering because
out of the group chat.
Yeah, because I became triggered. I'm in this group and people are passing away, and now it's making me depressed. And so you have to have a balance, and that's where the therapist comes in because this is an unbiased person. They're able to point things out that you need to identify along the way that you're not thinking. Yeah. They're able to give you a different perspective. So I say it's important to have both.
I totally agree with you on that. You definitely have to have both. I do. I second that. I third. It is all around support, okay? Get what you need. And again, I think as we close out, the biggest thing here that I want folks to take away is educate yourself. Yes. Again, we ain't forcing no hands. We're saying educate yourself on your rights and your choices that you have, because you could impact someone's life. Absolutely. If that is your decision to. But we also know and we acknowledge that there is and have been harm and there is the mistrust. But our health is important, and taking care of ourselves and thinking of it in another light of if I could help someone else, how impactful that could be. So I'm going to give you all the time, and then we're going to close out. If you could leave the audience with one piece of advice or information about organ donation, what would it be?
So I think one piece of advice, and it's really going to be following suit with what you just said, it is become educated and talk to the people around you about your desire. If you are interested in becoming someone who is going to donate, you can begin having conversations with your physician, start to look at articles and read good information, not necessarily just looking up random data or information online, but really becoming a little bit more interested in what's happening in the organ and tissue world. I do want to throw out last year, 168 Black patients in our community received a life-saving organ. And just with that one donor, we're able to save 8 lives. 2 people are able to have their sight restored through cornea donation, 75 more through tissue donation. And so thinking about the impact that individuals have in the community is important. But yes, become educated, become aware, have the conversations with your families, think it through, understand that it is your right and also a part of your will if you do decide to become an organ and tissue donator.
Any advice?
My advice, I guess specifically for individuals that are at the point where they're living with a chronic illness and may need an organ, you got to do the work. You know, your doctors and your specialists, they're only with you 15 minutes tops. You're with yourself 24 hours a day, 7 days a week. And so even if you're not sick, start making those conscious decisions about what you're putting into your body. Taking the time to also do your research. What type of soap are you using? Your laundry detergent, the foods you're eating, how you're preparing your foods, because we see people as you get older, things start happening. And so what can we do to prevent that in the first place? I think that's really, really important. And ask for help. It's okay to ask for help. It's okay to say that you need help and start to do the work with a therapist or a close friend to express yourself, because holding it in will stress you out more and then you'll further decline. There are so many organizations, there are so many support groups and medical professionals that are out here ready to assist our population, our communities. And so we have to do our part to get that information. So.
Well, thank you, too, for joining me for this conversation. Again, shout out to Mid-America Transplant for tapping me and being willing to allow me to come into this space and hold this important conversation. Again, I just hope you all take some awareness and education away from this segment, this episode, and truly think about how you can make an impact if you choose, or just keep having the conversations.
And if people are wanting to, you can go to sayyesgivelife.org if they actually want to explore that a little bit further in terms of putting themselves on the registry. Yeah.
All right. Well, thank you.
Thanks for having us.
Thank you. Thank you, guys. All right, y'all. Well, thank you for tapping into the Hood Talks podcast. This is the bonus episode. Keep tapping in. Season 5. We got a lot going on, y'all. We got a lot. But we out.
Mid-America Transplant is proud to sponsor the Hood Talks. Ever wish you had a superpower? Guess what? You do. You have the power to save lives with just one simple word. Yes. Yes to organ and tissue donation. Here's the reality. Patients from communities of color make up 60% of the organ transplant waitlist. You may know someone waiting because, sadly, Black people like us are more likely to face health conditions like kidney failure, high blood pressure, and diabetes, all of which put our organs at risk. But here's the good news. Donor heroes are changing lives. Last year, 168 Black patients in our community received life-saving organs. And just one donor has the potential to save 8 lives, restore sight to 2 people, and heal 75 more through tissue donation. So, be a hero. It only takes 2 minutes to register and say yes to saving lives. Sign up today at sayyesgivelife.org.
Don't forget to subscribe to our YouTube page and also follow us on all our social medias. And you can find all of that information at www.thehoodtalks.com.